First trimester. The first trimester will span from conception to 12 weeks. This is generally the first 3 months of pregnancy. During this trimester, the fertilized egg will change from a small grouping of cells to a fetus that begins to have human features. Month 1, weeks 1 through 4. Although it's strange, the first 2 weeks of pregnancy are a getting ready period. Your body slowly releases more hormones and your uterus prepares for a potential pregnancy. At the end of the second week, your ovary releases an egg, ovulation. If sperm meets an egg just after ovulation, the process to pregnancy continues. Week 3 fertilization occurs during the third week. A sperm and egg join and create a zygote. Week 4. The tiny bundle of cells turns into a blastocyst and implants into your uterine lining. The beginning of what will become the placenta forms. A watertight sac forms around the blastocyst. This is the amniotic sac, and it provides cushioning to a fetus during pregnancy. By the end of the fourth week, the blastocyst is about 2 mm long, the size of a poppy seed. Month 2, weeks 5 through 8. The second month of pregnancy is when most people realize they're pregnant. Pregnancy hormones go into overdrive, and by about the 5th week, an at-home pregnancy test will show as positive. This is when many people begin to feel symptoms of pregnancy. Week 5 the neural tube, brain, spinal cord and other neural tissue of the central nervous system forms. The tiny heart tube will beat 110 times a minute by the end of the 5th week. Week 6 tiny buds that become arms and legs also develop. Blood cells are taking shape, and circulation will begin. Structures that'll become the ears, eyes and mouth take form. Your healthcare provider can probably detect a heartbeat on a vaginal ultrasound. Week 7 bones begin replacing soft cartilage and genitals begin to form. The embryo's head is large in proportion to the rest of its body. Some people think the embryo resembles a small tadpole or seahorse due to its prominent tail, which becomes legs, and large head. Week 8 all of the major organs and body systems are developing. The fetus has web-like hands and feet. Eyes become visible and ears begin to form. The umbilical cord is fully developed and helps to transport oxygen and blood to the embryo. After the 8th week, healthcare providers refer to the embryo as a fetus. It will remain a fetus until birth. By the end of the second month, the fetus is about 0.5 to 1 inch long, about the size of a black bean. Month 3, weeks 9 through 12. The third month of pregnancy is when an embryo becomes a fetus. It's a period of rapid growth and development. The fetus develops distinct facial features, limbs, organs, bones and muscles. By the end of the 12th week, the fetus has an assigned sex, but it won't be visible on ultrasound for several more weeks. Week 9 the beginnings of teeth and taste buds are forming. Its muscles are forming and its body shape takes on more of a human appearance. But, its head is still 50% of its length. Your provider may be able to hear its heartbeat with a Doppler ultrasound. Week 10, 11 the arms, hands, fingers, feet and toes are fully formed, no more webbed fingers. Fingernails and toenails are beginning to develop and the external ears form. The external genitals also begin to form, but it's too soon to see them on an ultrasound. The fetus is starting to explore a bit by doing things like opening and closing its fists and mouth. Its knees, elbows and ankles are working, but it's too soon to feel any kicks. The bones are hardening, but its skin is still see-through. Week 12 all the organs, limbs, bones and muscles are present and will continue to develop in order to become fully functional. The circulatory, digestive and urinary systems are also working and the liver produces bile. The fetus is drinking and peeing amniotic fluid. Since the most critical development has taken place, your chance of miscarriage drops considerably after 12 weeks, the end of the first trimester. Most people begin feeling some relief from morning sickness now, too. At the end of the third month, the fetus is about 2.5 to 3 inches long, about the size of a plum.